Ladies and gentlemen, welcome again to KAREEM'S Clinic. Today, the topic of discussion is a crucial one. We are going to discuss cervical cancer. A lot of us, when the term cancer comes out of our mouths, it spells curse. But the truth is, cervical cancer is a condition that can be taken care of. It is not a death sentence as we may think. According to the National Cancer Institute, women, about 13,800, are diagnosed with cervical cancer almost every year. Most of these women are between 35 to 44 years. However, it is worth noting that there are new cases in younger women between the ages of 20 and 34. It is for that reason that we really need to talk about cancer, that every woman needs to know more about cervical cancer specifically so that we get a solution to this particular disease. Now, anatomically, the cervix is a narrow lower part of the uterus that opens into the birth canal. That narrow area between the uterus and the birth canal, remember I said I'll be referring to the vagina as the birth canal. That area is what we call the cervix. So if there is cancer in that area, that is what we call cervical cancer. Cervical cancer is a common disease among women world over. It's not only in the USA or it's not only in Kenya. It is a disease that is a problem world over. Now, the cervix has got cells. Remember, every part of the body, every organ of the body is made up of cells. It is from cells that we get to tissues, that we get to organs, that we get to organ systems. And now we are looking at cervix as a part of reproductive system. As I've explained, that cervix is that narrow area in between the womb, which is the uterus, and the birth canal. That area has cells. And these cells are divided into two. If you look at the outer surface of the cervix, there are cells. The cells within the outer surface and the cells along that canal, that path, the cervix downwards, are also different cells. The cells that are on the outer surface of the cervix are called squamous cells. And the cells that are column-shaped in the cervical canal, we are going to call them the glandular cells. Why am I insisting on these cells? I'm insisting on us to know these cells so that we know the cells that are affected within the cervix. So, the squamous cells always are majorly affected compared to the glandular cells. And this cancer, called the cervical cancer, cancer of the cervix, it begins at the meeting point of the two cells. Remember, these are a group of cells and they have a meeting point. That meeting point is where the growth starts. What is cancer? Cancer is that abnormal multiplication or abnormal cell division within the cervix. In this case, we are talking about the cervical cancer. And that cell division results to abnormal growth of the flesh around the cervix, And that means we are expecting that if you have cervical cancer, we are going to see some flesh grown due to overgrowth or abnormal growth of the cells around there. So the squamous cells are the ones that majorly get infected by the virus that causes cancer. That brings me to that virus that causes cancer. Remember, we are looking at the main cause of cervical cancer. Cervical cancer, 90% of this particular cancer is caused by human papilloma virus. So the human papilloma virus, we are going to refer to it as HPV virus. That is very, very much important to note. Now, where does the HPV virus come from? How does it cause cervical cancer? How will I avoid it? HPV virus is transmitted sexually. In other words, a woman will get the HPV virus from the man. So, somebody could be asking themselves, I've been copulating, I've been engaging in the intercourse for the longest period, but I've not suffered cancer. This HPV, do I have it or not? You have it. HPV virus come from men to women. The reason not all women have cancer is because the HPV virus does not just directly cause cancer. The HPV virus is divided into very many strains. In fact, over 100 strains. When I say strains, I mean types. The types of HPV virus. So, out of all these hundreds, or rather 100, there are 2 HPVs that commonly cause this particular cancer called the cancer of the cervix, and even many more. These are HPV number 16 and HPV number 18. Now, the HPV 16 and HPV 18, you will still get them. The rest, you will also get. Now, the rest can cause smaller issues like the genital warts, and the body is always in a position to fight them. That's why they don't manifest. But if you have risk factors and you get HPV 16 and HPV 18, chances are that you may grow the cancer, cervical cancer. Now, what do these have, HPV 16 and HPV 18? What do they have that the rest do not have? They have a protein. These ones produce proteins. Now, the proteins are called E6 and E7. Naturally, there are genes within us. They're the genes that stop or suppress the overgrowth of cells. They suppress production of tumors in our bodies. So these E6 and E7 are proteins produced by the HPV 16 and HPV 18. So what these E6 and E7 proteins do, they go and turn off the genes that suppress the tumors. So when the genes that suppress the tumors are turned off, then the tumors can now grow uncontrollably, and there is nothing we can do about it. This means that if I have man A, if a woman has man A, for instance, and they copulate, they have an intercourse with man A, and man A didn't have HPV 16 and 18 but had the rest of the HPVs, this woman is safe. But if the woman goes to a second man, man B, in other words, what I'm trying to say is that if you have many sexual partners, you risk this infection. Yes, it is real that cervical cancer is 70% to 90% sexually transmitted from men to women. Reducing the number of sexual partners is a way of preventing cervical cancer. And once you obtain the cervical cancer, during the first stages, once you acquire it, it is very difficult to know that you are suffering from this particular disease. So you will not know. So that is why we say you need early detection. But later on, there are symptoms that you will observe. Symptom number 1, vaginal discharge with blood and foul odor. That bad smell that is not normal. You discharge a lot, it has blood, and the smell is not just okay. Cervical cancer can also lead to swollen legs. You may experience swollen legs, even though not all swollen legs come as a result of cervical cancer. There are more other diseases that we will actually look at that could lead to your legs swelling. So if you realize all these combinations together, vaginal discharge with blood and foul smell, you realize you have a swollen leg at the same time, and during coitus, during intercourse, you feel a lot of pain. Also, you bleed after the coitus, after the intercourse, you bleed. And if you also realize that you have frequent urge to urinate, also with a pelvic pain, then that could mean that you have cervical cancer. Now, for you to experience all these, you will realize it is not at stage 0 or stage 1. This will be at later stages, 2 and above. However, some little discharge of blood may occur in stage 1. And that is why we usually say, the moment you realize that your blood is not normal, your discharge is not normal, don't hesitate. Kindly visit a healthcare facility closer to you. Prevention is actually better than cure. So, with all these symptoms, you can easily tell whether you have cancer, cervical cancer, or not. Who is at risk of this disease? We have people with compromised immune system. If your immune system is weak, then you are a candidate. You are at risk of this particular disease. What do I mean? There are people with other ailments. There are people with other diseases, other conditions, not only HIV, though HIV is included, especially untreated HIV. And I wouldn't want to say HIV because there are people who are HIV positive, but theirs is suppressed and they turn negative and they're treating their condition. So not every compromised immune situation results from HIV. Diabetes, just to mention but a few. So make sure if you are on medication, every other medication, adhere to that medication. Now, cervical cancer is for the women. So I'm talking to women on this. If you have many sexual partners, you are at greater risk because obviously we've said that the major cause of this particular disease is HPV virus. That is HPV, human papilloma virus. So if HPV is the cause, then where do they come from? HPV comes from the man to the woman. So you need to have one sexual partner. so that you narrow down the risks of getting it from different men. Probably the man you have doesn't have 16 and 18. Probably the man you have could be having 18 and 16, but your body knows how to deal with that. If you go to another man who has the same 18 and 16, and probably your body is not used to the kind of seminal fluid that you're going to get from that other man, it will come with its own ups and downs. So we really need to note that. Another thing, another risk is smoking. Women who smoke chances of stand a chance of every other cancer, by the way, including the lung cancer, cervical cancer, ovarian cancer, because whatever comes from the smoking, be it the tar, be it the tobacco, be it the bang, we need to avoid. Other STIs, if you are suffering from chlamydia, for instance, then your immunity will be compromised. And you suffering from other STIs means you have many sexual partners. So that is a very high risk. Also, many children, like if you are this person who keeps giving birth every year, every now and again, that is also another risk. One other risk that I would want to talk about is the misuse of e-pills and also the long-term use of birth control pills. If you use birth control pills over a long period of time, then you risk getting cervical cancer. If you misuse e-pills, let me explain something to you ladies. It's not wrong using e-pills. You can use as many as you want. However, try not to use more than 2 in one menstrual cycle. Don't use more than 2 in one menstrual cycle. Try to not to use more than 2 in one menstrual cycle. If your menses begin on let me give hypothetically first to 20, okay, let me say your menstrual cycle is between 1st to 28th. So from 1st to 28th, kindly just use 1 e-pill. So if you use 3 e-pills within a single menstrual duration, that period, then you will have more other problems just apart from this cancer that we are talking about. You will have issues with your hormones. You will also have issues with the regularity of your menses. And some of these things don't work. Sometimes you use the e-pill and the pregnancy still comes in. So kindly, let's stop using the e-pills, and they also cause cancer, as we have said. Now, there is one thing that I want to talk about as I clear this, as we come to an end. How do we prevent this? Early detection. Kindly, always go for pap smear. As long as you are between 21 to 65, make sure every 3 years you go for what we call a pap smear. So if you go for a pap smear, the pap smear will check if you have abnormal cells as part of the squamous cells or the granular cells within the cervix. If you do a combination of pap smear and HPV DNA test, then you can always do every 5 years. What I mean is, today, if you go and do a pap smear with a combination of HPV and HPV DNA test, then you can stay for the next 5 years, then you do another one, as long as you are 21 years of age. But if you are doing the pap smear alone, the pap smear is where they get into the cervix, they pick a sample they pick a cell or rather some piece of flesh from there, and they go to check the detection. There is all a lot of medical process that is involved that I can't just explain for us to understand, but it simply means they get there for the pap smear, they pick a piece of flesh from the cell, and then they check if it is cancerous or not. If it is, you will automatically get you'll get the cure for this. Now, why am I saying it is early detection is important? These things can be seen as pre-cancer. If you are at pre-cancer stage, you can easily be treated. And remember, treatment involves surgeries, radiotherapy, chemotherapy, just to mention but a few, and sometimes it involves all the three combined. Today, ladies, this has been a very key topic. We are going to look at more about these cancers. Anybody with a daughter 9 years and above, kindly take them for what we call HPV vaccination. Let them get inoculated, or rather vaccinated against the HPV virus. We have vaccines. Anybody 9 years and above. It is always good to take your child before they are actually active. You see, before they are actually active, they already don't have the HPV. They have not engaged in an intercourse. Therefore, it means they don't have the HPV virus. So they can easily prevent it. As opposed to when you are 25, you are going there, already you have some. Vaccination is for prevention. Even though you can also go. Anybody can also go. But of course, once you are above 35, the risks are, the positive effects are lower. The positive effects of the vaccine are lower. So time your daughters when they are 9, 10 years and they are not sexually active, they are just about the age, kindly let them get vaccinated. That is the time that I had with you, ladies and gentlemen. If you find this information useful to you, consider subscribing. Till next time, I am Kareem. Thank you.